Good evening, everyone. Sorry for a delay of 10 minutes. Today, the delay will start. Today's topic is anatomy of face, muscles, nerve supply, blood supply, and applied anatomy. Okay, so anatomy of face. The face, it extends superiorly from the adolescent position of hairline to the chin and the base on each side to the auricle. Okay, so this is the face. You know what is face. So we'll know the features of the skin of the face. Okay, the facial skin is very vascular. See, it is richly supplied with blood. So only therefore the face flushes and blanches. So when we are happy or when we are sad or whatever emotion, there is rush of blood supply or the blood drains suddenly from the face. That is why there is face flushing and face blanching, which is evidently seen on the face because facial skin is richly supplied with blood. Okay, next, wounds of the face bleed profusely but heal rapidly. Wounds of the face, as there is rich supply of blood, it bleeds profusely. A small cut also bleeds profusely, but it heals rapidly because the there is rich blood supply. Okay, the results of plastic surgery on face are excellent. That is why healing of plastic surgery and the results of plastic surgery on the face are excellent. They don't leave much scar, they heal beautifully. That is why this is because of the rich vascularity of the facial skin. And the facial skin is rich in sebaceous and sweat glands. We know that. Sebaceous glands keeps the face oily, but also cause acne in young adults. Okay, we know this. Small girls, boys, they have acne in their teenage. This is because of sebaceous glands. Next, sweat glands help in regulation of body temperature. We know sweating is the most important process to keep ourselves cool in hot summers. Okay, so the facial skin is more lax. That is, as you can see, the facial skin is not tightly attached to anything. It is it is lax compared to other skin, skin on the other parts of the body. That is why facial skin is the first one to get wrinkled. Then age, as age advances, the first skin to get wrinkled is the facial skin, especially around the eyes, around the mouth. We get wrinkles because of age, because facial skin is lax. Okay, and also there is a rapid spread of edema. When a person is suffering from kidney disease, the first edema develops in the face because there is space. The skin is lax. Okay, next, the facial skin is fixed to underlying cartilage. The facial skin is fixed to the underlying cartilage. That is why underlying cartilage, like nose and ears, that is why boils in the nose and ears are very painful. Okay, because the skin is attached to the underlying cartilage. And the facial skin is very elastic because facial muscles are inserted into it. The facial muscles are inserted into the facial skin. That is why the facial skin is very elastic. And wounds of the facial skin tend to gape. Wounds of the face tend to gape the because of the elasticity of the facial skin. Okay, so this is about the peculiar features or special features of the facial skin. Next, muscles of the face. First of all, we'll see the face. As I told you, it starts from the adolescent hairline. So even muscles of the scalp also, they merge or they overlap on the facial muscles. So the muscles of the scalp which overlap, muscle of the scalp which overlaps is the occipitofrontalis muscle. Okay, and muscles of the auricle, that is ear, or 3. Auricularis anterior, auricularis superior, auricularis posterior. Muscles of the eyelids: corrugator supercilii, orbicularis oculi, levator palpebrae superioris. These are the 3 muscles of the eyelids. Okay. Next, muscles of around the nasal opening: procerus, compressor nares, dilator nares, depressor septi. Okay. And muscles around the mouth: orbicularis oris, buccinator, levator, buccinator, levator labii superioris, zygomaticus major, levator anguli oris, zygomaticus minor, depressor anguli oris, depressor labii inferioris. So these are the muscles around the mouth. Okay, so this is, and these are the, and muscles of the neck is platysma. So these are the superficial facial muscles. Superficial fascia, facial muscles, that is superficial fascia, not facial muscles. It contains, facial muscles are inserted into the skin. It contains vessels and nerves and variable amount of fat. Okay, superficial fascia peculiarities are, their facial muscles are inserted into the skin. That is why they bring about various facial expressions. Embryologically, the muscles developed from the mesoderm of second branchial arch. That is why they are supplied by the facial nerve. Functionally, these muscles are regulators of 3 openings of the face. That is eyes, nose, and mouth. They are regulators of the 3 openings of the face. Muscles of the face are muscles of scalp, auricle, eyelids, around the nose, and muscles of neck. Muscle of neck is platysma. So we discussed the muscles of the face in the earlier slide. Okay. Next, common facial expressions and the muscles producing them. So see this can be asked. Actually, this is a commonly asked question. Name some of the common facial expressions and muscles producing them. This can be asked for 5 marks. See, today's topic is must know, and only SAQs and MCQs are asked. No LAQs are asked from this today's topic. Okay. So SAQ can be asked. Name a few muscles of facial expression and the muscles producing them. Okay. Sorry. First, surprise. It is produced by the corrugator supercilii and procerus. Dislike is produced by dilator nares and depressor septi. Anger is produced by dilator nares and depressor septi. Smiling and laughing is produced by zygomaticus major. Grinning is by risorius. Sadness is by levator labii superioris and levator anguli oris. Depressor anguli oris causes grief. Okay, and closing of mouth, kissing, whistling is caused by orbicularis oris and buccinator. Okay, doubt is caused by mentalis. Horror, terror, flight is caused by platysma. So these are the common facial expressions and the muscles producing them. So next, nerve supply of the face. So motor supply of the face is by facial nerve. Okay, sensory supply of the face is by trigeminal nerve. So the motor supply of the face is by facial nerve. The 5 branches of the facial nerve, which you can remember by a mnemonic: 10 zebras bit my cat. That is TZBMC. T for temporal, Z for zygomatic, B for buccal, M for marginal mandibular, and C for cervical. So these are the 5 branches of the facial nerve which supply the motor, which give the motor nerve supply to the face. Okay, so it is very easy to remember: temporal, zygomatic, buccal, marginal mandibular, and cervical. Temporal branch of facial nerve supplies frontalis, auricular muscles, orbicularis oculi, that is upper eyelid. Okay, zygomatic nerve supplies auricularis oculi, lower eyelid. Buccal, it supplies cheek and upper lip. Marginal mandibular supplies lower lip. Cervical branch of the facial nerve supplies platysma. Okay, so these are the nerves of the motor nerve supply of the face. Very easy to remember. 10 zebras bit my cat. This is the mnemonic. So temporal, zygomatic, buccal, marginal mandibular and cervical branches of the facial nerve. Okay, next sensory nerve supply is by trigeminal nerve and cervical nerves. Trigeminal nerve is cranial nerve 5, facial nerve is cranial nerve 7, trigeminal nerve is facial nerve 5. Okay, and cervical nerves C2, C3 and C4. So that is facial, the trigeminal nerve has 3 branches: ophthalmic, maxillary and mandibular. So ophthalmic nerve is, that is V is not, it is not V, it is the Roman number 5. So 5, 1, that is fifth cranial nerve, first branch, that is ophthalmic nerve. Okay, of cranial nerve 5. Maxillary branch of V2 or 5-2 is maxillary branch of cranial nerve 5. 5-3 is the mandibular branch of cranial nerve 5. And these are the nerves, cervical nerves, that is from the spinal cord, C2, C3, C4. So these supply the sensory nerve supply of the face. Okay, so you can see this area is supplied by ophthalmic branch, this area by maxillary branch, this area by mandibular branch, and this by cervical nerves. Okay, clear? So this is about the sensory nerve supply of the face. Next, arterial supply, blood supply of the face. Arteries of the face: facial artery and transverse facial artery. These are the arteries which supply the face, and other branches which are the arteries accompanying the cutaneous nerves, which are branches of ophthalmic, maxillary and superficial temporal arteries. So these are the arteries supplying the face. Okay, so see, only such a small part, it has so much of blood supply. That is why it is richly vascular. You can see facial artery is a branch of external carotid artery, then maxillary facial, transverse facial and superficial temporal artery. Veins. So veins, we can see it forms a shape of a W on each side of the face. So this is the, from the subclavian vein is the facial vein or common facial vein, and retromandibular vein, which comes from behind the mandible. So these two are the main veins. Okay, other veins, they join the arteries, accompany the arteries, and they drain into common facial vein and retromandibular vein, and the veins on the side form a W shape arrangement. You can see this W like this, see, like this W. Okay, so these are the veins of the face. Next, clinical anatomy. Okay, the sensory distribution of trigeminal nerve explains headaches. Headache, which is a common symptom in common cold, whatever is involved, because trigeminal nerve gives the sensory supply. So if we have cold, we'll have headache. If we have sinusitis, we'll have headache. If we have teeth pain, gum pains, we'll have headache. If we have refractive errors like myopia, hypermetropia, we'll have headache. If there is meningitis, we'll have headache, because these are commonly supplied areas of the trigeminal nerve. Okay, sensory supply of all these is by trigeminal nerve only. That is why even face sensory nerve supply of the face is also trigeminal nerve. That is why wherever, if there is infection or any condition of these places, headache is a common symptom. Okay, next, trigeminal neuralgia involves one or more divisions of the trigeminal nerve. It causes attacks of severe burning and scalding pain along the distribution of the affected nerve. Whichever branch is affected, the branch that along the distribution, there will be severe burning and scalding pain, because trigeminal nerve supplies the sensory, gives the sensory supplies, gives sensation of the face. That is why if that nerve is affected, definitely it will cause pain and burning. Okay, next, Pulsation of the facial artery can be felt at the base of the mandible along the antero-inferior angle of the masseter muscle, okay, and at about 1.25 centimeters lateral to the angle of the mouth. Okay, so pulsations of the facial artery can be felt. So rich vascularity of the face helps in rapid wound healing. This we have already seen. Next, danger area of the face. Danger area of the face is, it is lower part of the nose, upper lip, adjoining part of the cheek. These are the danger areas of the face. Lower part of the nose, upper lip, and sides of the adjoining part of the cheek, that is around the nose, cheek around the nose. Why are these dangerous? Because the facial vein is directly connected to the cavernous sinus inside the brain. So whatever infection to this area, okay, if there is any infection or due to injury, if there is any embolus, this directly travels into the cavernous sinus. And also the facial vein does not have any valves. Okay, the facial vein does not have any valves. That is also one of the reasons the infection and emboli can directly go into the cavernous sinus, and it can cause meningitis or any other brain infection. Okay, that is why it is called as a danger area of the face. Sorry. Okay, affected areas. This is because, as I told you, the facial vein is directly connected to the cavernous sinuses through emissary veins. Okay, so this is about the applied anatomy of the face. So it is a general overall view of applied anatomy. See, sensory distribution of trigeminal nerve, like it gives sensation, pain sensation, it gives headache, and also trigeminal neuralgia can cause lot of pain and burning along the nerve distribution. Then pulsation of the facial artery can be felt in the base of the mandible, at the base of the mandible. Rich blood supply of the face, he helps in rapid wound healing. And also facial veins do not have valves and they are directly connected to the cavernous sinus. That is why infection and embolus can directly get transferred to the cavernous sinus and cause complications. So this is about the applied anatomy of the face. Okay, next. So probable MCQs. As I told you, this topic has only MCQs and SAQs. That is only multiple choice questions and short answer questions. There are no long answer questions from this chapter in the curriculum. Okay. So the motor supply of the facial muscles is by facial nerve. This 10 zebras bit my cat is these are the branches of the facial nerve. That is, T is temporal, Z is zygomatic, B is buccal, M is marginal mandibular, and C is cervical. These are the 5 branches of the facial nerve. Next, the temporal branch of facial nerve supplies the frontalis. That is the muscle of the forehead. Okay, orbicularis oculi is mainly supplied by zygomatic branch of the facial nerve. The marginal mandibular branch supplies the lower lip. The marginal mandibular branch supplies the lower lip. Platysma is supplied by the cervical branch of the facial nerve. The sensory nerve supply of the face is mainly by trigeminal nerve. The ophthalmic division of trigeminal nerve is by, that is, ophthalmic branch. That is fifth cranial nerve, first branch. The ophthalmic division of the trigeminal nerve is 5-1. Okay. The maxillary division is 5-2. The mandibular division is, it is mixed. Okay, also called 5-3. That is, it is both sensory and motor. Mixed means it is both sensory and it supplies both, it gives both sensory and motor supply. Okay. Next, pain from paranasal sinusitis is referred through trigeminal nerve. Okay. Next, trigeminal neuralgia causes severe burning and stabbing pain, as I told you, along the nerve distribution because it gives sensory sensation to the face. The facial artery can be palpated at the angle of at the base of the anterior mandible anterior to the masseter muscle. The facial artery is a branch of external carotid artery. Veins of the face ultimately drain into internal jugular vein. The dangerous area of the face is upper lip, adjoined chin, that is around the nose and nose. So this is the dangerous area of the face. The area is dangerous because the veins lack valves. Facial vein communicates with cavernous sinus. Infection from upper lip may spread to brain via facial vein to cavernous sinus directly. Rich vascularity of face results in rapid wound healing. Okay, and these are the short answer questions. Enumerate the 5 terminal branches of facial nerve. Mention the motor nerve supply of muscles of the facial expression. Write the sensory nerve supply of the face. Name 3 divisions of trigeminal nerve. What is trigeminal neuralgia? Where is the pulsation of facial artery felt? Name the arteries of the face. Name the main veins draining the face. What is the danger area of the face? Why is it dangerous? So these are the short answer questions. Okay. So this was today's class. If you please share, subscribe and comment. If you want notes, PDF notes, DM to me. Okay. Link is in the Instagram bio and also Facebook bio. You will get PDF. And also those who have stayed till the end will get PDF notes. Okay. And tomorrow's topic is physiology, that is physiology of hemoglobin. Okay. So wait for tomorrow's session. We'll meet you tomorrow at 7:30. Thank you.